In this video I will be talking about the temporal bone. First I will talk about the external surface of the temporal bone, which consists of this squamous part, and then we have mastoid part, and here we have mandibular fossa and other things. First, squamous part. Squamous part has groove for the middle temporal artery. These are for the middle temporal artery, and this is the mastoid part. Squamous part and mastoid part together, they start forming this zygomatic process. This is the zygomatic process, then it attaches to the zygomatic, like it forms the zygomatic bone. So we will begin with this mastoid part. First of all, we have a crest here. This is the crest. It's crest above the mastoid. This is mastoid process, or you can say mastoid. So here we have the crest above the mastoid, so it will be supramastoid crest. It means above the mastoid crest. So here we have suture. As you can see, the suture is between the squamous part and the mastoid part. So this suture will be squamomastoid suture. I am marking here. This is the squamomastoid suture. Here at the body of the mastoid we have a foramen known as mastoid foramen, which is for the exit of the emissionary vein. In front of it we have this external erythematus. This one here we have external erythematus, and then we have this tympanic part. As you can see here, I mark it. This is the tympanic part. Here the main thing, we have the mandibular fossa for the attachment of the condylar process of the mandible. So condylar process of the mandible makes a joint here known as temporomandibular joint, and this joint is like a glenoid. So this tubercle, we have a tubercle as it is posterior to the glenoid, so we will say it post-glenoid tubercle. So name for this is from, like you can say, post-glenoid tubercle, this tubercle. Now we have this tympanic part, and then external erythematus above. This is the external erythematus. So above the external erythematus there is suprameatal, like it above the meatal. So we have a triangle here. This is the suprameatal triangle. Now we have another landmark, which is process, which is the styloid process. I will talk in detail about when I will be talking in the inferior surface of this bone. So here we have two another sutures. Like here we had total three sutures in this external surface. And the first one is squamomastoid, and the other one here we have, this is the tympanic part and this is the mastoid part. So suture between these will be tympanomastoid suture. Here we have, this is the tympanomastoid suture. And next here we have another suture which is between this squamous part and this tympanic part. So this will be squamotympanic suture. So now we have the inferior surface of the temporal bone. In here we can see this is the mandibular fossa. Posterior to the mandibular fossa we have external erythematus here, and here we had tympanic part. And as I discussed earlier, we have the vaginal process of the tympanic part. This is, here you can see, this is the vaginal process of the tympanic part. So now start from the anterior part to the posterior. We will discuss about the foramens and other things. First of all, this is the petrous part. This is the inferior surface of the petrous part, but we will discuss the petrous part at the end of this video. Here we have this opening of carotid canal. Carotid canal starts from here and exits it. So here is the carotid canal, and then we have this jugular fossa. Here we have jugular fossa. This is the jugular fossa. So one thing to remember, one most important thing to remember, in between the carotid canal and the jugular fossa we have this fistula petrosa. This is the, sorry, I just marked a little bit extra. So in between the carotid canal and jugular fossa we have fistula petrosa. Here this is the fistula petrosa. Then we move to this styloid process. This is, as you remember, this is styloid process, and this is the mastoid. So in between the styloid and the mastoid we have this stylomastoid foramen. This is the stylomastoid foramen for the exit of the seventh cranial nerve, which is the facial nerve. Here we have this mastoid process. Then we have this posterior to the mastoid process we have this notch. This is the mastoid notch, and right after this mastoid notch we have occipital, sulcus for the occipital artery. So these are very much connected to each other and it's hard to differentiate. The only way you can remember is that first we have mastoid, so we will have mastoid notch here, then we have the posterior to mastoid we have occipital bone, so we will have occipital sulcus. So the main way to remember the inferior surface is first you remember that we have the carotid canal, then we have the jugular fossa. In between the carotid canal and the jugular fossa we have the fistula petrosa, and here right after the mandibular fossa we have tympanic part, posterior to the tympanic part and the anterior. This is the stylomastoid or styloid process. So anterior to the styloid we have the vaginal process. These I know they are very difficult things to remember, but if you watch the video again and again you can understand it. So after the styloid process we have this stylomastoid foramen, as it is in between the styloid process and the mastoid. And then here we have mastoid process. Posterior to the mastoid process we have mastoid notch. Here as you can see, right after the mastoid notch we have sulcus for occipital artery or occipital bone, whatever you say. So you have to remember, first we have mastoid notch, then sulcus for occipital artery. This is all from the inferior surface, and now we move to the petrous part. Now let's talk about the petrous part of the temporal bone. It has three surfaces. This is the anterior superior surface, this is the anterior posterior surface, and then we have the inferior surface, which I have discussed already. So now first talk about the anterior superior surface. This surface has very few landmarks. First we have, this is the spine. This is the spine of the petrous part, which attaches with the body of the spine and makes the foramen lacerum. So spine of this petrous part takes part in the formation of the foramen lacerum. And then here we have just trigeminal impression. Right here we have trigeminal impression, and then as you move backward, here we have the arcuate eminence as it is mentioned here. So this portion is arcuate eminence, as you can see here. And then here we have the tegment tympani. This is very important. The tegment tympani, we take parts in the, it's a structure for the roof of the middle layer. So here we have tegment tympani, arcuate eminence, and here we have trigeminal impression, and this is the spine. Now anterior posterior surface we have this internal acoustic meatus. On the external surface we studied about the external meatus, but here we have the internal acoustic meatus for the passage of the vestibulocochlear nerve. Here from here vestibulocochlear nerve passes, and right posterior to it we have another aqueduct for the vestibule. Here it is. And then we have the superior margin of the petrous part. Here is the superior margin of the petrous part. This is the superior margin of the petrous part. And then here as you remember, we have the medial surface of this mastoid. We have mastoid foramen, and we have few more structures, but they are not clearly visible here, so I will just take you to the picture from where we can just be a little bit more clear. So here let me just draw. As I mentioned earlier, this is the spine. This portion, let me just make it a bit bigger. This is the spine on the anterior superior surface. Right below the spine we have carotid canal. Here we have the opening for the carotid canal, as it moves here and then it moves to the inferior surface, and you can see the inferior surface. Here from the body of this sphenoid we have a sulcus known as carotid sulcus. This is the carotid sulcus, not on the spine. I have just marked it extra, but it goes like this way. So this is the carotid sulcus. So here on the anterior posterior side, we, as I discussed in the other diagram, we have the internal acoustic meatus here, and then we have this foramen. This is the jugular foramen here. This foramen is jugular foramen. I should mark with other color. Here is the jugular foramen, and right here we have this sigmoid sulcus here, just about here, not on this border, but below this we have a sulcus, and the name of the sulcus is sigmoid sulcus. So here we had trigeminal impression right here, which I just marked, and then we have arcuate eminence here. This is the arcuate eminence, and then we have this tegmen tympani. Here we have tegmen tympani for the roof of the middle layer, and I don't know, so there is something else. So this is enough for the temporal bone.